Orange County Medical Group was founded in 2006. Our philosophy is to provide our patients with holistic health with conventional medicine.
There are a variety of different fields of medicine that we integrate here at Orange County Medical Group. Number one that most people are familiar with is allopathic medicine. Allopathic medicine basically uses surgery and medications in order to help a person with health-related issues. Dr. Miller and I are both osteopathic physicians, and an osteopathic physician basically utilizes a more holistic type approach in order to help a patient achieve better health along the way. Osteopathic philosophy focuses around the use of improved circulation and improving circulation to tissues in order to help the tissues get their nourishment and get their oxygen supply. We also utilize manipulation in our practice, and that is a big part of helping restoring circulation to tissues. Myself, I also use chiropractic manipulation, as I had practiced as a chiropractor before going to medical school, and doing manipulation there focuses on helping free up the nerve, so the nerve supplying the organs can help the organs direct their function better and communicate the messages to and from the organs so that the organ does what it's supposed to do. We also utilize acupuncture here. Acupuncture can be used for anything from pain control in helping patients with allergies. Acupuncture can also be very helpful in patients trying to quit smoking and in weight control.
We offer here a variety of weights and methods to lose the weight. We do education to our patients. We also offer a medical, supervised weight loss program with the help of prescription medications. Truly promote, inner and outer beauty just by being healthy, not from the inside, but also from the outside.
Our office, we do something called bioidentical hormones. Bioidentical hormones make up the same exact chemical structure as what we find in our body naturally occurring. And when your natural hormones have decreased, you want to supplement with something that is just like what your body was producing.
There's a whole panel that we look at to ensure all the hormones are interfacing and at their optimal levels. Mm-hmm. Right, Jess?
Right, and everyone kind of has a different thumbprint where what works for me might not work for you, which might not work for Anna. So it's definitely individualized, and that's the thing about bioidentical hormones. It's on an individual level where, prescription, Premarin or whatever, that's just, this is your dose, and if it works for you, great. If it doesn't, well, then there's nothing else. So that's why bioidenticals are so awesome.
So it's all customized. It's not a one-size-fits-all.
Exactly. Exactly.
And see, the beauty of the bioidenticals, they're made out of nature, right, Jess?
Right.
So they're not what we call synthetics. So
Rashmi
it's very nice.
Everything that she uses at her pharmacy is plant-based, so they come from soy or yam, and
sterile technique.
Exactly, sterile technique, and that's all she does is compounded hormones. So she's not pulled in many different directions. She just focuses on that.
And no synthetic. She doesn't use any synthetic hormones.
Right. The bioidentical hormones come in many forms. Topical cream, which we're all common. I mean, you see people in the movies, rubbing the cream on. There's also capsules. There's drops. There's lozenges. But a newer way, however, it's been around for quite a while, for about the last 30 years, but it's recently coming on the market, and it's something that we do in our office called pellets. And the pellets are bioidentical hormones, like we talked about before, about the size of a rice grain, and they're inserted under the skin. We do estrogen and testosterone pellets, and they're slow released over 4 to 6 months. So it's more of a steady state of the estrogen and the testosterone in your body. So it's not something that's dependent on if you're rubbing that cream on or taking that pill.
Or if you forget.
Exactly.
Like I used to always forget.
Right. So, and the pellets are really amazing, and people are loving them. And it's nice to not have to worry about rubbing that cream on. And like I said, it keeps that steady state in the bloodstream, so you're feeling really good. And men and women can do the pellets, and men will get the testosterone pellets.
I tell you, hands down, as long as I've been doing this and providing hormones for men and women, the pellets by far, wouldn't you say, Anna, the pellets by far, especially
Absolutely.
the men love the pellets. I
Yes.
mean, we've just gotten phenomenal results
Results.
because their testosterone levels go up and they remain up. And you don't get this up and down, so their mood doesn't swing up or down, or they have to rely on other prescriptions to maintain their erectile function. Although you can use both together, which is complementary, but oftentimes they don't even need that. I've just seen incredible results. I personally have the pellets in. I would forget to use the creams, or I forget to take a capsule, and it really helps maintain my hormone levels consistently for several months.
It is really a very nice, steady release upon demand.
And it's just something easy, same way. We
Right.
measure your blood, and then
Right.
based on your blood results, that's how we know what pellets to give you. And then when you
Right.
start to feel like something's, you know, you start to get those hot flashes or whatever back, we can check your blood again and see if we need to give you
Right.
more or the same dose, or it's really great. And the hormones, like we were talking about before with your skin, I mean, they just really help with the
Oh,
skin.
you're just vibrant. You
Right.
have that glow.
Mhm.
I
With
always
this-
describe it to women as you'll just have this glow. You'll know. You can tell the difference.
Right.
You just are alive again.
So in addition to educate our patients into hormone balance, we also offer a variety of cosmetic procedures. So we offer FDA-approved procedures like Botox, fillers, cosmeceuticals, and peels.
We want our patients to communicate with us, and we try to promote that. We'd like to sit down with them and have a conversation with them and really find out what's going on in their lives and really find out what their needs are and what their expectations are along the way.